Hello, welcome. My name is Jeff Stevens. I'm one of the founding owners of Village Caregiving. It's a real pleasure to welcome you to our company, to our team, to our family. In this video series, we are going to cover a lot of topics. This includes everything from training to provide excellent care, to payroll, to employee benefits. Village Caregiving's mission statement is keep your heart at home. It's very important to us that we allow the elderly to age gracefully, with dignity, in their own homes for as long as that is safely possible. Today we're going to talk about some additional training. I will talk a little bit about the history of the company, but above all else, it's really important that we remember that providing excellent care in the home is our top priority. Village Caregiving was founded over a decade ago in January 2013 by three lifelong friends, Andrew Moss, Matt Walker, and me. And the company has grown over the years, but the core values have always remained the same. We are still a privately held company. It's not a franchise or a chain. The same values that were important to us 10 years ago remain just as important today. We're going to talk a little bit about those throughout this video, but I'll give you a preview. The foundational stones of Village Caregiving are to use common sense and always do the right thing. The care that you provide will of course be more nuanced than that, but those are cornerstones that you can return to throughout any day that you work at this company. Does this make sense, what I'm providing for the client? Am I doing the right thing here? That's important to us, and we hope that it's important to you too. Equally important to us is being honest. It's as simple as that. So today in this video, we're going to review the Code of Conduct and Ethics. Everyone here will need to pass a background check, but to put it very, very simply, please, it is absolutely crucially important that you are always honest with your client there in the home and with the client's family, that you're always honest with the office staff that you deal with on a day-to-day basis. In this training video series, you will receive specific instruction on various aspects of home care. Let me up front explain what we do and what we don't do. What we do is we are a home care provider that provides ADL support, that's activities of daily living. This can include bathing, ambulation, hygiene, eating, meal preparation, companionship, light house cleaning, and the like. What we don't do is to provide skilled care. Skilled care can include administering medication, providing skilled therapies such as nursing care, diagnosing conditions, or administering any medical treatment. While we don't provide skilled care, it is important to remember that we do have a large staff of nurses that are here to help your client, and they're here to help you provide the most excellent level of care that is possible. The nurses are here to assess your client, they're here to train you and other staff members, and they are here to answer any question that you might have on call 24 hours a day. I mentioned earlier that Village Caregiving has a very clear code of conduct and ethics. Let me return to that for a moment. During your onboarding, you receive training from the director staff at your office regarding this code of conduct and ethics. From an owner's perspective, I would like to also remind you it is vital that we adhere to these policies. So, in this video training series, we will review the code of conduct and ethics in detail. If at any later point you should like to review it again, please reach out to your office staff and we will provide that for you. This code of conduct and ethics is vitally important because it will contain reminders for you of things that we must always do, and also contains things that we can never do. This is very important. In this video series, we will be covering a range of topics that will set you on a path for success in your career at Village Caregiving. On behalf of everyone at Village Caregiving, the owners, the executive team, our director staff, thank you for joining our team. Thank you for coming aboard and helping to serve what is a very important mission in the home care industry, to serve the elderly in their own homes. It's very rewarding. We're happy that you're a part of the team.
Hi, my name is Corey Watson with Village Caregiving. In this video, we're going to go through the Code of Ethics line by line. The Code of Conduct and Ethics is extremely important for all of our caregivers and all of our staff across our company. It's extremely important because you are the face of our company that's out there amongst our community and taking care of our clients. And it tells us what we can and can't do for each client. Now let's take the time to go through the Code of Conduct and Ethics together. Providing quality care to clients is Village Caregiving's mission and always must be the top priority. Village Caregiving's personnel must always conduct themselves with honesty and integrity. Doing the right thing and common sense should always guide your actions. Not every question has the perfect answer, but you can always fall back on common sense. As an employee, you must report your time accurately and honestly. There is a zero tolerance policy for sexual conduct with clients. Village Caregiving personnel may not ever engage in behavior a reasonable person would interpret as inappropriate involvement in a client's personal relationships. If you ever have any questions or need any clarification for what is inappropriate behavior, please contact your executive director, nurse, or director of operations. Under no circumstances are you allowed to accept a gift from a client. Village Caregiving personnel may not ever accept a loan or borrow money or property from a client. Village Caregiving personnel may not ever consume alcohol while providing services to a client. You cannot consume illegal or unprescribed drugs that will impair you while providing services to your client. Village Caregiving reserves the right to drug test all employees. You cannot leave your client's home during a shift without permission. During your shift, if an emergency happens, immediately call 911. You must always treat the clients and their families with respect. During your shift, you must not engage in any activities that distract you. Excessive distractions might include unreasonably watching television, movies, or videos, or playing video games on your phone, excessive cell phone use, excessive smoke or vape breaks, providing care to someone other than your client, sleeping or napping during a shift, bringing an unauthorized child, friend, relative, person, or pet to a client's place of residence, unwelcome discussion of religion or politics with a client or others, unwelcome discussion of a personal issue with a client or others. Abuse of any kind is not tolerated at Village Caregiving. Exploitation of a client or their family members is never allowed. You have a duty to report all suspicion of abuse, neglect, or exploitation as soon as possible. You must keep all information about a client confidential. Remember, you must never publish any information about a client on social media. Village Caregiving does not allow any conflicts of interest. For instance, you may never be a power of attorney for a client. You are not allowed to make decisions or be designated to make decisions for a client. You must comply with record keeping and reporting procedures. You must refrain from selling items to or purchasing items from clients. You must refrain from unreasonably consuming a client's food or drinks. Unreasonable use of a client's personal property is also prohibited. Never manipulate a client for your own personal gain. Always respect other skilled or non-skilled healthcare providers. Please remember, it's your responsibility to understand these principles. If you have any questions, please remember to contact your executive director.
Hello, my name is Ben Keenan with Village Caregiving. Today we're going to talk about payroll and reporting. At Village Caregiving, the pay periods run from the 1st of the month through the 15th, and the 16th through the last day of the month. This means that you will receive 2 direct deposits per month. These direct deposits will hit on the 5th and the 20th of each month. And that said, if the 5th or 20th falls on a non-business day, you will receive your direct deposit early. The direct deposit will hit on the last business day before the 5th or 20th of the month. Daily care notes are completed for each individual client. These care sheets are also utilized as your timesheet. The care sheets should be completed to align with our pay periods. Your care sheets should be completed for each client from the 1st to the 15th and the 16th to the last day of the month. Let's cut to an example and see what this looks like. When completing your daily care notes, it's important to fill them out as precisely and neatly as possible. Please fill out your client's name and date of birth. Circle the month the services were completed and the dates you worked with the client. Record the start and end times of your shift and correctly calculate your total hours. On the daily care notes, we must document the task we completed during the shift. If, in this example, you help the client with grooming, bathing, dressing, meal prep, and laundry, you should check the appropriate boxes to record the task performed. Moving further down the care sheet, you'll see a notes section. The notes section is to be used to capture additional information the office should be aware of. To complete the charting of the daily care notes, you must have the client sign, or the point of contact for the client must sign. Also, you'll need to print your name and sign. Once we obtain signatures from the client and you, the daily care notes are complete and no other information should be added to the daily care notes. Please know that all payer sources have a different operating rhythm, and you should reach out to your office staff to get clear direction on how to complete those tasks for the payer source. Tiger Connect is a HIPAA-compliant platform that allows you to send sensitive information. You will be utilizing Tiger Connect to turn in your daily care notes, allowing you to complete the payroll process on your end. Please understand that you are responsible for turning in correct, complete daily care notes on time. You are only eligible to be paid once your care sheets are completed and turned in. This is what your communication from your director will look like. The office will send you a message through Tiger Connect. When you open the text, you will see this message. You'll see that it states that you have a secured message from Village Caregiving. To go to the next step, click on the blue hyperlink. Please note, you cannot respond to this text. You must click on the blue hyperlink to respond. When you click on the link, it will take you over to the internet. You are now on a secure Village Caregiving site. This message you now see is a payroll message telling you the pay period, when your direct deposit will hit, and telling you the deadline to submit your daily care notes. To submit your daily care notes, click on the plus button and select the option Take Photo or Video. At this point, the camera on your phone should pop up. When taking a picture, make sure it captures the full daily care note. Once you've taken a suitable picture, select Use Photo, and then select the option to send the photo. Once you confirm that the status reads Delivered, you have successfully submitted your daily care notes for payroll.
If you're going to call off from a shift, please give us immediate notice. No call, no shows are unacceptable at Village Caregiving. We'd like to have a 24-hour notice to where we could find a replacement, but if not, we understand that emergencies happen. So please make sure that you give us as much notice as possible whenever you call off. It's important that all of our clients have the service and care that they need. They're relying on us to be there and to take care of them. Showing up on time is extremely important because our clients depend on you. If you must miss a shift, it's extremely important that you notify one of our office staff members so that we can get a replacement. In addition to showing up on time, it's important that you're always professional with our clients. This means that you provide the care your client needs and act responsible while in your client's home. Professionalism also includes your appearance. Scrubs are preferred, but they are not required. Even if you don't wear scrubs, please wear neat, clean clothes and refrain from wearing inappropriate clothing. You must have a valid ID. If you don't have a Village Caregiving badge, please reach out to one of our office staff members. Professionalism also includes being able to communicate properly with your director and your client. Please contact your director if you're going to miss a shift. If you see anything inappropriate or unusual, please reach out to one of our office staff members.
Village Caregiving carries full coverage workers' compensation insurance. If you are injured on the job, please report any workplace injury to your executive director or director of operations, as these are time-sensitive issues. The quicker we get the information surrounding the incident, the faster we can get the claim processed as the employer. If you work in any of these states, please be aware that in addition to reporting the workplace injury to Village Caregiving, you will need to report the injury to your state workforce department, as these states are self-funded. What is a workplace injury? As a general rule, all injuries and illnesses which result from events or exposures while on the clock are presumed to be work-related. Again, if you're ever unsure or have questions about a workplace injury, please err on the side of caution and reach out to your local office staff.
Hi, my name is Amy Bullington. I have a Master's of Science in Nursing and work as an adjunct professor and clinical manager to educate nursing students and hospital staff. Today, I'm going to teach you some patient care and safety techniques to help you be the best caregiver you can be. At Village Caregiving, we assist clients with their activities of daily living. We will now be talking about safe and appropriate ways to assist clients with their activities. When it comes to infections, falls, injuries, and other negative consequences that can occur with a client, it is important to remember that we can't prevent everything, but we can seek to minimize the risk. As a caregiver, it is your responsibility to help minimize the risk of infections in your clients. In order to do this, you must always follow standard precautions. Wash your hands per CDC guidelines before and after contact with the client and the client's environment. Remove any watches or jewelry. Wet your hands with clean running water and apply soap. Scrub your hands for at least 20 seconds, ensuring you scrub the back of the hands between the fingers and under the nails. Rinse. Dry hands with a clean paper towel, then use another clean paper towel to turn off the sink. Wear gloves if you have contact with body fluids, contaminated items, mucous membranes, or non-intact skin. When putting gloves on, perform hand hygiene. Ensure gloves are clean, fit properly, and are not damaged. Pull gloves all the way up to your wrist. Wear a gown as needed to protect your skin and clothing from body fluids. Wear a mask and goggles if you might get splashed or sprayed by body fluids. Never handle sharps. You can only remind clients to properly dispose of their sharps. Disinfect the environment routinely. Another vital part of protecting the client is ensuring the client's environment is safe and healthy. Help your client to keep their area free of clutter that could cause injuries and bacteria that could cause illnesses. Needing help with a bath or shower can often be scary and stressful, as most clients have not always been accustomed to being dependent on someone else to help them with this process. When assisting a client with a bath, it is important to act professional and show respect. You should maintain safety during a bath through the following actions. Wear rubber-soled shoes, ensure the floor is dry, and non-slip rubber mats both in the shower or tub and outside of it. If a tub bath is ordered in the plan of care, do not fill the tub more than 6 inches. Do not allow the client to soak for more than 20 minutes and empty the tub before helping the client to get out. Test the temperature of the water with your wrist and have the client do the same. Use all assistive devices such as grab bars and shower chairs properly. And always follow the client's plan of care when it comes to the type of bath they receive. I will now demonstrate how to give a bed bath, which is used for clients who are not able to safely move or receive a shower or tub bath. Not all clients will receive bed baths, but it is important to know how to help a client who needs the maximum amount of assistance. First, verify the appropriate type of bath in the client's plan of care. Observe the client's physical condition and tolerance to ensure they can appropriately and safely follow the plan of care. Gather all necessary supplies and equipment and arrange within reach. Fill a wash basin 2/3 full of water. Check the water temperature with your wrist and have the client do the same. Explain the process to the client and allow for their feedback and preferences. It is important to follow a client's routine as long as it is safe and allow them to have as much independence as safely possible to promote dignity. Encourage the client to use the toilet prior to the bath. Perform hand hygiene and apply clean gloves. Raise the bed to a comfortable working height if applicable. Place a clean sheet or towel over the client. Assist them in removing clothes while keeping the sheet or blanket covering them. Wash face, being careful to gently wipe the eyes from the inner to outer corner and using a different part of the cloth for each area of the face. Be sure to clean in all skin folds and to inspect the skin for any areas of redness as you bathe the client. Wash the arms from hands to underarms, chest, abdomen, legs from ankles to thigh, and then the feet. Using a separate washcloth, wash the perineal area front to back. Apply new gloves. Then help the client into a side-lying position. Wash the back and then the buttocks from front to back. If fecal material is present, dispose of washcloth in an appropriate soiled linen bag. Assist the client back to a supine position. Remove gloves and perform hand hygiene. If a client wishes to have non-medicated body lotion or deodorant, apply new gloves and assist them if needed. If shampooing the client's hair, place a bath towel over the client's chest. Fill a water pitcher, testing the temperature of the water with the wrist and having the client do the same. Position the person for shampooing in bed by lowering the head of the bed, removing the pillow, and supporting the neck with a folded towel. Place a waterproof pad and a wash basin under the client's head. Place a washcloth over the client's eyes, being careful not to cover the mouth and nose. Wet the hair by pouring the water pitcher over the hair and into the basin. Apply shampoo to your hands and lather through the hair, massaging at the hairline and working towards the back of the head. Rinse with the water pitcher until the water runs clear. If applicable, apply conditioner over the ends of the hair and rinse. Squeeze out excess water from the hair. Cover the hair with a clean bath towel and rub gently. Dry the face with the towel on the chest. Assist the client in combing the hair and putting on clean clothes. Make the bed. Lower the bed if applicable and ensure the client's comfort and safety. Then dispose of all used materials appropriately, remove gloves, and perform hand hygiene. While performing oral hygiene, it is best before and after meals. The client should perform oral hygiene every 12 hours at minimum. Inspect the teeth, gums, and mucosa for any cracks, bleeding, swelling, or other unusual observations. If a client has dentures, ensure they are intact, clean, and functioning appropriately. Let's look at how to properly clean a client's dentures. Perform hand hygiene and apply clean gloves. Offer client hand hygiene. Place a clean washcloth in the sink. Instruct the client to remove dentures from the mouth and gently assist if necessary. Brush all areas of dentures with a toothbrush and cleaning agent. Rinse dentures in clean water. If the client wishes to reinsert their dentures, assist them in cleaning their gums and using mouthwash before assisting them with reinsertion. If the client wishes not to reinsert their dentures, place them in water in their designated enclosed container. Perform hand hygiene. When assisting a client with a meal, it is vital to maintain safety. Always ensure the client is in an upright, seated position before eating to help minimize the risk of choking or aspiration. Offer small bites. Never rush a meal. Pay attention to your client's ability to chew and swallow. Report any changes or if you do not think the diet is appropriate for the client. If you suspect the client is choking or has aspirated, call 911. If you are going to help a client transfer a loan, you must ensure the client is smaller than you, predictable and can follow directions, able to help in some way. If these three conditions are not met, do not move a client alone. Contact your office to ask about getting help. In order to help mitigate the risk of injuries when assisting a client, always use proper body mechanics. Spread your feet at least shoulder width to maximize a wide base of support. Bend your legs, not your back. Lift objects close to your body. Raise beds or tables to a comfortable working height. Keep your work area directly in front of you and turn your whole body when needed to avoid twisting. Push rather than pull when able. Do not lift objects higher than your chest. Use both hands and arms to lift. If the client has a hospital bed, raise to a comfortable working height when working with the client. Ensure safety by lowering the bed all the way down and raising upper side rails when not working at the bedside. And again, if additional assistance is needed in moving your client, contact your office. Now, let's look at how to help a client safely transfer and ambulate. Observe the client's willingness and ability to transfer safely. Use proper body mechanics and continually provide a safe environment. Place the chair at a 45-degree angle to the bed, facing the foot of the bed and midway between the head and the foot of the bed on the client's stronger side. Lock the wheels on the wheelchair. If the bed has brakes, they must be locked as well. After checking the safety of the wheelchair, raise the footrest and swing the leg rest outward. The leg rest should be removed if they cause an obstacle for tripping. Turn the client onto their side to face you. Place one arm under the client's head and neck and the other over the client's thighs. Shift to gently swing the client's legs over the side of the bed while lifting the client's upper body. Help the client into a comfortable position sitting on the side of the bed. Allow the client to sit on the side of the bed for several minutes, ensuring they are not dizzy nor short of breath. Assist the client in putting on stable, non-skid shoes. Direct the client to scoot near the edge of the bed so feet are flat on the floor. Maintain a wide base of support with knees facing the client's knees. Grasp around the client's chest area. On the count of 3, instruct the client to push up with their arms and stand up, ensuring stability. Assist the client in pivoting with back directly facing the chair. Instruct the client to reach back for the arms of the chair for support and slowly lower. Ensure the client is positioned all the way to the back. Swing the leg rest inward and lower the footrest. Assist the client in resting their legs and feet properly on them. Evaluate for proper body alignment, comfort, and safety. Determine the client's ability and willingness to ambulate. If more assistance is needed and not available, do not proceed. Gather necessary equipment, such as a gait belt, and ensure the area is free of tripping hazards. Assist the client in putting on stable, non-skid shoes. Apply the gait belt, if applicable, ensuring you can fit 2 fingers under the belt. Grasp the belt in the middle of the client's back and help the client to stand. Stand on the client's stronger side unless they are using an assistive device such as a cane, walker, or handrail. If using an assistive device, stand on the client's weaker side. Step forward with the client, maintaining the same speed and steps. Allow the client to ambulate as desired with the amount of assistance required, continually observing the client's environment and ability. If the client becomes dizzy, weak, or tired, assist them to the closest chair or bed to sit safely. Perform hand hygiene and apply clean gloves. If applicable, raise the height of the bed and lower the head of the bed to a flat position. Stand on the side of the bed opposite of the way the client will face. If applicable, lower the side rail. Move the client to the side of the bed closest to you in segments. Cross the client's arms over their chest. Place one arm under the client's neck and shoulders, grasping the far shoulder, and the other arm under the client's mid-back. Move the client's upper body towards you by shifting your weight from the front to the back leg. Place one arm under the client's waist and the other under the client's thighs to move the lower body towards you. Repeat for the client's legs and feet with your arms under the client's thighs and calves. Keep the client's arms over their chest and cross the client's near leg over their far leg. Assist the client in turning away from you. If leaving the client side lying, provide comfort and support by placing a pillow under all pressure points and behind the back to provide comfort and to help mitigate the risk of pressure injuries. Keep the heels floated and ensure the client is not laying on any items or either arm. Lower the height of the bed to a safe and comfortable level and raise side rails for safety if applicable. Properly dispose of gloves and perform hand hygiene. Offer hand hygiene to the client. When assisting a client with bathroom needs, remember, if a client needs assistance going to the restroom, always respond promptly to reduce the risk of skin breakdown and falls. Always wipe from cleanest to dirtiest, which is front to back. And always report any unusual observations such as a change in the client's ability to control elimination or a change in the amount or frequency. Blood or mucus in the urine or stool. Pain with elimination, or color and odor changes. There are different types of toileting depending on the client's ability. It is important that you follow the plan of care. Also be aware of your client's strengths and abilities that day, and never push them past what they are safely able to do. Some clients are able to safely ambulate to the restroom. A bedside commode may be used for a client if they can safely stand and pivot or walk a short distance, but cannot safely walk to the restroom. A handheld urinal may be used for clients with mobility difficulties. A bedpan may be used for bedbound clients. A bedbound client who is unable to control their ability to eliminate may need to wear a brief. I will now demonstrate a few ways you may assist a client with their bathroom needs. Changing an incontinent client. Perform hand hygiene and apply clean gloves. If applicable, raise the head of the bed with side rails up, lower the head of the bed to a flat position, and lower side rails on your side. Place a disposable pad under the buttocks. Loosen the tabs on the sides of the brief. Roll the brief towards the buttocks and tuck, ensuring contents do not leak out. Turn the client to face the side opposite from you. Observe for any unusual concerns and discard of the used brief appropriately. Wearing clean gloves, perform perineal care by wiping cleanest to dirtiest, front to back, and cleaning all skin folds. Remove gloves, perform hand hygiene, and apply new gloves. With the client still on their side, Slide a clean, disposable pad and new brief under the client's buttocks. Smooth out the pad and tuck the brief between the client's legs, ensuring it is centered in the perineal area. Roll the client back onto their back. If needed, roll the client to the opposite side enough to remove the soiled brief and pad, and untuck and smooth out the other side of the clean ones. Spread the front panel of the brief, ensuring that the penis is positioned downward if applicable. Secure the tabs of the brief and smooth out any folds or wrinkles. Lower the height of the bed to a safe, comfortable level and raise side rails for safety if applicable. Properly dispose of gloves and perform hand hygiene. Offer hand hygiene to the client. If the client uses a urinal, follow all safety and standard precautions as stated in the Changing an Incontinent Client video. Assist the client into the appropriate position. They may lie on their side, sit on the side of the bed, stand at the bedside, or sit elevated in the bed. Offer towels or a disposable pad to prevent spills. Assist the client in positioning the penis inside the circular opening with the urinal held below the flow of urine. Allow the client to assist as much as they are able and provide as much privacy as safely able. Once the client has finished urinating, offer a tissue for perineal care and assist them if necessary. Observe the urine for anything unusual before emptying into the toilet and flushing. Rinse the urinal by filling with water from the bathtub and pouring out in the toilet. Dry and return to appropriate location. Properly dispose of gloves and perform hand hygiene. Offer hand hygiene to the client. If the client uses a bedpan, follow all safety and standard precautions as stated in the Changing an Incontinent Client video. If the client is able to assist, instruct the client to lay on their back with linens out of the way. Bend their knees and lift their hips. Slide the bedpan under the client's hips and position it appropriately with the deep, open end facing the foot of the bed. You can also slide a disposable pad under the bedpan to minimize spills. Have the client slowly lower onto the bedpan and offer as much privacy as safely possible. Once the client has finished, provide them with materials to perform perineal care and assist if needed. Dispose of perineal care supplies properly. Instruct the client to bend their knees and lift their hips. Slide the bedpan out, being careful not to spill. Set the pan on a flat surface draped with a disposable pad until the client is back in a comfortable position. If the client needs more assistance, roll the client onto their side facing the opposite direction. You can also place a disposable pad under the bedpan. Place the bedpan against the buttocks in the appropriate position. While pushing the bedpan into the mattress, roll the client onto the bedpan, providing as much privacy as safely possible. Once the client has finished, roll them onto their side, facing the opposite direction. Keeping the bedpan flat, steadily slide it out and set it on a flat surface draped with a disposable pad. Assist the client in performing perineal care and dispose of perineal care supplies appropriately. Assist the client into a comfortable position. Observe the urine and/or stool for anything unusual before emptying into the toilet and flushing. Rinse the bedpan by filling with water from the bathtub and pouring out into the toilet. Dry and return to appropriate location. Properly dispose of gloves and perform hand hygiene. Offer hand hygiene to the client. The U.S. Administration on Aging defines elder abuse as any knowing, intentional, or negligent act by a caregiver or any other person that causes harm or a serious risk of harm to a vulnerable adult. Let's go through some types of abuse with examples. Physical abuse is the intentional use of physical force that results in illness, injury, pain, impaired function, distress, or death. An example would be choking or hitting a client. Financial abuse includes two categories. Exploitation is misusing a person's money, property, or assets. For example, forging a client's signature. Misappropriation is the illegal, dishonest, unfair, or wrongful use of a person's money, property, or assets for one's own use. For example, taking money from a client. Abandonment is leaving a vulnerable adult alone, such as a caregiver leaving a shift early without notice. Neglect is the failure of a caregiver or responsible person to protect a vulnerable person from harm or provide food, water, clothing, shelter, health care, and other activities of daily living to a vulnerable person. An example would be leaving the client sitting in urine or feces. Sexual abuse is forced or unwanted sexual interactions of any kind. Remember, as a caregiver, you are never allowed to have any kind of romantic or sexual interactions with a client. Emotional abuse is verbal or nonverbal behavior that causes mental pain, anguish, fear, or distress, such as yelling or threatening. A few possible signs of abuse include frequent, unusual injuries, lack of hygiene and safe living conditions, and emotional problems. All clients at Village Caregiving are considered vulnerable, meaning they are more at risk of being abused due to their decreased ability to care for and protect themselves. As a home care provider, you are considered a mandatory reporter. This means federal and state laws require you to report any suspected abuse.
Let's discuss what to do when your client's condition changes or during an emergency situation. Always be aware of your client's normal. If something has changed with your client, please let the directors know immediately. Here are some things that you should be aware of that could be a change in your client. Skin injuries, changes in eating habits, changes in bowel habits, changes in mood, changes in the client's ability to perform activities of daily living, or the client tells you that they feel ill or different. If you notice a non-emergent change in your client, please contact your director immediately. So we have talked about non-emergent situations. Now we will discuss some examples of emergent situations. Changes in client's level of consciousness, bleeding, seizures, difficulty breathing, falls or accidents, severe pain and especially chest pain, suicidal thoughts, or a sign of a stroke. This is what to do in an emergency situation. First, call 911. Second, contact the client's emergency contact. And 3, contact your village caregiving director.
Well, hope you've enjoyed today's training video. We've covered a lot of topics, everything from the code of ethics to specific caregiver techniques. In addition to what you've seen today, we have a wealth of other materials available to you. Training modules, hours of video. Remember also that these videos are a source of knowledge which you can return to at any point during your employment. If you have any other questions or would like supplemental training, please do not hesitate. Reach out to the director at your local office. And on behalf of everyone at Village Caregiving, I would like to say, welcome to the company.